Hello guys, my name is Desmond and I welcome you to my YouTube channel. Ladies and gentlemen, for today I'll be speaking with someone who studied nursing. So this video is actually meant to answer the questions asked by a lady from Eastern Cape. Her name is Asanda. So I assume you've seen a video where I was asking Asanda some questions, and then towards the end of our discussion she also asked questions that was directed to someone who studied nursing. So luckily today there's someone that I'm going to call who's going to assist in answering those questions. So ladies and gentlemen, I'm not alone. I'm with some learners, one from Gauteng, the other one is from Limpopo, the other one is from KZN, Pumalanga, and I forgot. And the other guys from Northern Cape. So, ladies and gentlemen, it's unfortunate they are not able to fully participate. They are only able to hear the conversation, but they are not able to directly respond. So, I'm just going to give them an opportunity to ask additional questions, as I'll be directing those questions from Asanda to our guest for today. So what I'm going to do now, without any waste of time, is just to give him a call with the hope that he's available to assist with the questions. Okay, there we go. So let's just give him a call. Hello? A conversation with a lady called Asanda from Eastern Cape. Ne? So her age is 29. She completed her matric in 2013. So in high school she was doing these subjects. So these are her major subjects: agricultural sciences, geography, life sciences, and mathematics. So she's currently upgrading 2 subjects, which is life sciences, and she started maths literacy. So she was doing mathematics, but then now she's doing maths lit. So she had about 5 questions, of which I'm just going to pose this question to you to assist with some answers. And on the line, I've got some few guys from different provinces. So as soon as I'm done with these questions from Asanda, I'm just going to randomly choose some questions from these guys so that you can also be able to assist. So I'm not really sure if you're 100% ready to start with the first question.
Yeah, well, I'm okay.
So she's saying at this age, age 29, if I get at least level 4, will I get in nursing? So the other subjects are fine. She's only concerned about these 2, life sciences and maths lit. So she's asking if she gets level 4 at this age 29, will she be able to get in nursing?
Well, let me comprehensively answer a question in that the minimum set requirement to get into a nursing program is level 4 in your life sciences, level 4 in mathematics, or level 5 in mathematics literacy, level 4 in life sciences and or physical sciences. So you need a minimum to a degree program, and you need a minimum of 24 points to be admitted into a diploma program. The degree programs are offered at the universities, so that those are the minimum requirement in terms of academic performance. Another limitation is that to be taken into a nursing program, you must be 35 years and below.
Or 35 years and below.
Yes, at age 25, at 29, she's still well within the age range to be considered. So at the minimum requirement.
Oh, okay. No, I see. The second question is, at this age, will I be accepted to study nursing advice? So I think this question was covered in question number 1. So
yes.
so that means she just have to make sure that with life sciences, let's say with life sciences and a maths lead, if she can at least get level 5, then she'll stand a good chance of making it to nursing, isn't it?
Certainly.
Yeah, okay. And then now, the other question was, how did you learn to deal with failure? So obviously in this case, he wasn't specific. So I think also when you respond to this question, you can also just give a general response, or otherwise you can somehow create a scenario of which you can just make her understand. So I'm thinking maybe she wanted to check in case if you had some modules that you failed while you were at varsity, how did you deal with those? And again, maybe if you applied for a certain job and you failed, how did you fail? I mean, how did you deal with a failure? So that's a third question.
I'm going to take us through 3 stages.
Yeah.
1, it's because she's already repeating her matric. I understand that she failed her mathematics, and she's now upgrading her mathematics, and she's converted to mathematics literacy. So the first step that she's taken tells me that she did not take failure, but she just took the tear of her path, because if she had accepted it as a defeat, she wouldn't be upgrading her mathematics right now. So for her, it was a learning curve, and it's very commendable. It's a very bold step that most of the people would dream of doing, but they would not take the necessary steps to take them. So that I applaud her, and I am very envious of her courage.
Yeah.
When you get into nursing, the misconception that we have, or the society has been having this for such a long time, is that nursing is a simple course, or it's a simpler course for people maybe who could not get to the courses of their choice. But that's very false, if I may say.
Yeah.
When we went to university together, myself and yourself. When I was in university, I had the same conception that I'm going to fail through nursing, and my arrogance was maybe attributed to the fact that I was doing extremely well in my nursing course. But as the course was growing, I realized that the background of the life sciences that I had was sufficient to take me through first year. But for me to go through second year, third year, and fourth year, I needed the understanding of the nursing science, which you can only acquire through learning when you're in the university or in the nursing college. And it's extremely difficult.
Yeah.
The other part that comes with that is that you are learning the concept of science and you practicing it at the same time. So 2 days you are in class, the other days you are in the practical area. So you need to grasp fast so that you don't become a medical legal hazard, because now you need to be able to understand what you're doing to the patient in the hospital. And that needs a certain level of balance. Most of the people, when I enrolled at the University of Johannesburg, if I may say, they were taking 50 students. I think in our second year, our class had almost 80 students. This now is the number that matricularly graduated from first year to second year, and the number that was repeating second year. And mostly in second year, this is the level where a lot of people break out of nursing, or they get S7s if you are in universities, or they get to be terminated if you are in nursing colleges, because the workload is a lot.
Yeah.
So to be able to deal with that, it only takes 1 or 2 things. 1, preparation. You need to prepare. You need to prepare your lessons. You need to make sure that when you go to the clinical, you need to learn as much as possible. The fortunate thing about being a nursing student is that whatever you're learning in class, you get a chance to practice it in practical in the hospital. So which means you have the ability to can learn and not come back and read this concept if you grab them correct in the hospitals. But if you don't grab them correct, you can fail at them decimally. So being prepared is what I can urge any nursing student, not just Asanda, but any nursing student, to say be prepared. Be prepared for the amount of work that is you're going to learn. Nursing in its nature, it's a non-scientific course. Unlike maybe medicine, radiography, pharmacy, where you're going to learn a specific field in health. In nursing, you're going to learn every field. So you need to understand pharmacy, you need to understand medicine, you need to understand physiotherapy, you need to understand every other thing, because you are the supporting structure. As they want to call them in health, that you are the backbone of the health system. So you need to know everything for you to be able to treat your patient comprehensively. So it's going to take way much more than any other student in the health sciences.
Okay, no, I see. And then her fourth question was, how can I communicate more effectively? So also on this question, she wasn't specific, but I'm not really sure if there's a correlation between effective communication to the cause that he wants to pursue. So I'm thinking even on this one, you can just maybe give a general response. So the question is, how can I communicate more effectively? It's unfortunate I didn't have an opportunity to ask to ask in which way she means, because when we were having our conversation, everything was clear, it was straightforward. I'm assuming maybe let's say in case of presentations, or maybe she's not that much confident with the communication. It's unfortunate, I'm not really sure in which way, but that's what I'm thinking. You can also just provide a general response to this one, and also to indicate if you need to be that much confident with communication. So I'm not sure if you can be able to answer this one in any way possible.
If I was answering a student in my tutoring class, I would give a scientific answer. But I understand this is Asanda and other grade 12s who want to be nurses. But let me bring in this brief definition to say nursing is the art, and I want you to highlight art. It's the art to be able to correlate science and humanity.
Science and humanity.
So, when you are nursing a patient, you need to be able to communicate with this patient effectively to know exactly what the problem is. So you come with your science, you know what might be the problem. This patient is coughing, but you need to be able to ask them, why are they coughing? When did they start coughing? How does the cough make them feel? So you need to be articulate in your you need to be at your confidence as well. You need to be able to grab what the patient is saying without the patient maybe saying it out. I'm coughing, and I've been coughing for 2 weeks. You need to be able to firstly say, okay, this patient is coughing. What could be causing the cause? And you start from your science, you start surfing down to coming down to the differential diagnosis. What could possibly be the reason for this specific cough? So you need to be an effective communicator. However, some people are not born effective communicators. So the course in its comprehensive, or the whole sum of the course, we have communication modules where they will go into essence. It's going to help you articulate your feelings more. It's going to help you be able to understand the patient's feelings without imposing your values. So they're going to start them with psychology. If they're in university, you get to be in class and study psychology in depth, so that you can understand the person's behavior, you can understand the person's reactions to certain stimulus, and you can be able to understand why would a patient act in a specific manner. So that, because traditionally or generally in human nature, we are people with biasness. I'm from Venda. So there are certain things that when they are done in my vendor culture means something, but for somebody else they mean something different.
Yeah.
So you need to be able to articulate that as well, to say, okay, I'm from vendor, I'm working in Gauteng. So the fact that somebody didn't take off their head as they were telling me or talking to me, that doesn't necessarily mean disrespect. It just means something else in a different part. So there are modules that are going to effectively sensitize you to communication. They're going to sensitize you to culture. They're going to sensitize you to religion and a lot of things. Because I'm coming from an African background, but I'm treating somebody who's Muslim, who's Christian, who's, you see. So you need to be able to articulate yourself holistically to be able to deal with this patient. So there are modules within health sciences, but there are things that a person can do themselves to try and help themselves to communicate effectively.
No, I see. And then a last question. I think I'm just going to take a last question. I'm receiving a lot of questions, but I think maybe we can just do this last question, and I'll just take one question from there. I think maybe if we happen to have another chance, we'll just go through these other questions. There are many, but I notice we've spent a lot of time on Asanda's question, so we can just finish off the last one, then I just pick up one. So her last question is,
no problem.
How many modules were you doing for each year, if you remember? So she was more interested in knowing how many modules you were doing during your first semester, and then from there she added to say, actually, if you remember, for each year you can just indicate how many modules you were doing and for how long is the course.
Okay, the nursing degree that I did at the time, it was called the Legacy Course R425.
Yeah.
Right now, they have a new course, the R171. So the one that I did, it's a 4-year course. It came with an honors. The one that they are offering right now is a 3-year course. So I think let me try to bring it to what she potentially can study. It's a 3-year course. In that 3-year course, I would lie if I say I know the content of the module. But when I was in first year, I had psychology, I had sociology, I had physiology, I had human anatomy, I had fundamentals of nursing sciences, I had communication, I had, what am I leaving out? I think I had 8. And then these major modules, they were divided into module 1 and module 2.
Yeah.
So eventually there would be 16, around about 16.
Round about 16.
16 per semester. So 16 per semester, 16 in the second semester. And each one of them has different paper 1, paper 2.
16 per 6 months. 16 per, it's even less than 6 months, because you know that's, I think we start somewhere in February and then towards end of June. So 16 per let's say 16 per 5 months.
Yes. It's a lot. It's a lot. That's what I'm saying. It's a lot to grab in. But some of these modules, they were not exam based, as in you're going for an exam. Some of them you do an OSCE. So they just want to test your skills. How much have you grasped this skill? And then you do an oral exam, and then you get to be assessed on that.
And those 16 modules per semester, do they are they included in the practicals, or practicals it's something separate?
Some modules, they would, paper 1 is the theory, paper 2 is the practical, and then some you would write paper 1 and paper 2. Like your the non-nursing modules, your psychology, they didn't have practicals. Your human anatomy, they practicals, and human physiology had practical.
Yeah.
The nursing module, paper 1 is theory, paper 2 would then be a practical module.
Oh, okay. No, I see. Yes. So I'm getting a lot of questions. I think maybe these questions are interesting, so we can just quickly answer this question. So they're saying, what did you want to become when you were in primary and again in high school? So the sense I'm getting in this question is, whatever that you wanted to become when you're still in primary, was it still the same career that you wanted to pursue when you were still in high school, or did you have some changes along the way?
Interestingly enough, I'm going to let me answer this way. Interestingly enough, In the year 2002, I was in preschool. I did a play in creche, in preschool. You know, all of us aspire of being an engineer. I had the idea of being a medical doctor. And when I was in grade 9, when I was choosing modules, I chose modules that aligned with being within the health science faculty. At grade 9, I was convinced that I want to be within the health sciences. So my choices as I was applying different university was medicine, medicine and nursing. So I applied at the University of Pretoria. I applied at university.
Yeah.
So upon matriculating, or at 12 actually, I was more convinced about nursing. Maybe because I was then checking my grades, I was falling just above the 60% average when I calculated. So I knew that I stand a less chance of going to medicine, but the alternative that would keep me close to what I want to do was nursing sciences. So I then started to focus my energy and everything towards nursing.
Yeah.
So, I always knew I wanted to be in the health science faculty. I remember I even stopped applying altogether to different universities that was not offering either nursing or medicine.
Yeah, and I see. So in conclusion, I think some of these other questions we can just visit them some other time. So in conclusion, what do you say to someone who is in matric? They are either in that stream of business studies or sciences. What do you say to that one learner who's in matric? They are busy writing their exams, but they still say they haven't decided to, they haven't decided in terms of what they want to study as soon as they are done with their matric. What do you say to that? One thing for sure, let's say their marks are good, so one thing for sure, they are going to make it, but then they are not sure of what to study as soon as they are done. What do you say to that learner as we conclude our conversation?
I would say that researching what you want to study, certain for sure, it's much better than taking a hasty decision to enroll for a course that you don't really understand what it is, what it's going to be, and how it's going to turn out, or how it's going to pan out in future. So it's just unfortunate that we are people of color, black in particular, from poverty-stricken background. We don't have the luxury to take a gap year and just linger around. But if you do have that as much as possible, if you are still in lower grade, you are still in matric, and you think right now you don't have chance because your applications are closed, go and explore as much as possible. I had friends when I was matriculating that they had base marks, but because we were matriculating from a better performing students in our district, and we had that pressure of saying, if you were in this stream and you were in this class and amongst this kind of people, you had to go to university. I have friends that when we matriculated, we went to vet university. We went there, they got accepted into courses they didn't even understand what they entail. 3 years, 4 years down the line, they have degrees that they can't even use because these degrees are not marketable, or they are academic degrees. You have to get an honors, a master's, a PhD for you to be relevant in that field. And they end up being frustrated. So I would advise anyone, if you want a degree that will get you a job at the end of 4 years, sit down, check your options, gauge how much to earn, and know how much the course that you're going to study are particularly going to pay you, and then make it an informed decision. If you're not sure, ask.
No matter. Thanks very much for responses to these questions, because it's unfortunate at some point the line was cutting, but I'm thinking on our next discussion I'll just repeat some of the questions based on the response that I'm getting from these learners. They've sent a lot of questions. It's unfortunate won't be able to cover all of them in this conversation. But otherwise, for now, in conclusion, I would say please do enjoy your day, and then I'll make sure that on our next discussion we'll just go through all these other funny questions.
No problem at all.
Okay, thanks, Matt.
Thanks for having me.
Sure.
And good luck to your learners and their exams.
Sharp with them.
Thanks.
Okay, guys, I think that was a fruitful conversation. I'm pretty much sure that Asanda is going to be very much happy with the response that we got from our guest for today. So, ladies and gentlemen, I notice you've sent a lot of questions. I'll just indicate to you some of the questions that I received. Did you ever repeat or skip a grade in high or primary school? And then some of the questions that I received: how would you describe your high school character? Were you the type to study a day before or skipping classes? Obviously, I think there she's actually asking, were you the type to study day before you write exam, skipping classes, active in class, during lessons, studying ahead, etc., or the opposite is the truth? So these are some of the questions that I received from the learners who were listening to this conversation. Remember, guys, I'm not sure if I indicated to our guests for today that these learners were part of this conversation, but unfortunately they were not able to directly engage in our conversation. They could only hear, and from there, when they develop some questions, they just send those questions to my WhatsApp. So these are the questions that I'm reading now. So it's unfortunate we have spent a lot of time on this, on Asanda's questions. So I think we'll just do part 2 of this video to just go through these questions. And at some point, the line was breaking a bit. So I'm thinking, even though it did, but the amount of response that we got, it's enough for us to just draw some conclusions on this, on the responses that he was giving us. So some of the questions: is it good to study and have part-time job at the same time? So these are some of the questions that I received. Between high school and varsity, which one is difficult? Let me see. So ladies and gentlemen, these are the questions that we'll be going through on our next how did you deal with peer pressure, and which pressure did you experience the most? Which stream or major high school subjects did you study at? I think this one was answered. And then how many modules were you doing first? Okay, did you apply for accommodation while you were still in high school? Were you coping with the new teaching style, and how is it different from high school in terms of teaching style? So ladies and gentlemen, these are the questions that we'll be going through on our next conversation, and I hope you did enjoy as much as I did. So thanks to Asanda, a lady who asked her 5 questions, five most important questions, and I think she was fully answered. So ladies and gentlemen, in case you are not part of this conversation on my WhatsApp, you can still drop some questions on the comment section, and then from there I'll include those questions on our next conversation. Otherwise, you can just send them to my WhatsApp, and I'll make sure to include those questions. So ladies and gentlemen, thanks very much for joining. My name is Desmond, and I'm out.